Assalamu alaikum rahmatullah. This is Dr. Faisal Fozan. I'm originally a dentist and I have a 1-year diploma in infection prevention and control. This is one of the lectures in the Infection Control Dental Education Program, which is Infection Control during Clinical Procedure. As we all know, infection prevention and control is to prevent or reduce the risk of healthcare associated infections between patients, employee, and visitors. We must do a plan to help us in reducing the risk for transmission of infectious agent during patient care. Also, the planning will make the treatment sessions more efficient, and it will also make the post-treatment infection prevention and control process easier and more effective. So, the planning will help us before, during, and after. Infection prevention and control practices for use during clinical activities are divided to 3 parts. We're going to talk about each one of them separately. The first one, infection prevention and control practices during the pre-treatment period. The second, infection prevention and control practices during the treatment period. The third one, infection prevention and control practices during the post-treatment period of patient care. Do we have to follow these guidelines with all the patients? Actually, yes, because we are never certain of the patient's status. Either that the patient themselves don't know it or they don't want to tell us about it, either because they are ashamed or they are afraid that we won't give them the treatment. Infection control during the pre-treatment period, which start even before the patient enters the clinic. All personnel involved in patient care should prepare themselves for the incoming patient. Regarding PPE, you should prepare the PPE needed according to the procedure planned. So, if you're planning for only examination, the PPE needed is different than if you are planning to do restoration or doing surgery. And please don't forget, you must wash your hands. And why should we wash our hands? It's well established that the hands of the healthcare worker are the principal cause of transmission of infection from patient to patient. And remember, hand hygiene is a very simple action, and it remains the primary means to reduce hospital-acquired infection and the spread of antimicrobial resistance organisms. According to global research, it indicates that the improvement in hand hygiene activities could potentially reduce hospital-acquired infection rates by up to 50%. The hand washing sinks should be dedicated for hand washing only, and consider use of hands-free faucets and touch-free soap and alcohol-based hand rub dispenser to minimize contact with the surfaces, so it won't get contaminated. Remember, you must perform hand hygiene before and after wearing gloves for all procedures. Gloves plus hand hygiene equals clean hands. Gloves without hand hygiene equal germ transmission. When you don your gloves, you must inspect them for manufacturer defects or tears that may not be easily visible but can allow blood or other potentially infectious material to contact skin. So, how is hand hygiene done if you have a surgical procedure? Surgical team member should scrub their hands and forearms with either water and antimicrobial soap or with a non-antimicrobial soap followed by the use of alcohol-based hand rub with persistent activity. The surgical team member should follow the manufacturer instructions for the instructions when using this material. Rinse and dry with a sterile towel. The towel used for drying hands should be disposable or changed for each patient. WHO said that the hand hygiene compliance worldwide is less than 40%. And as we know, that some of the research indicated that the improvement in hand hygiene activity will reduce the hospital-acquired infection by up to 50%. The hand hygiene is simple, fast, and the products are present. So, what's stopping us from doing it? The problem here is the human factor. So we should think of solutions to increase their compliance. Personal protective equipments. In dental clinic, we wear protective clothing, mask, protective eyewear, and gloves. Each one of them have its own types. So we must decide what types of PPE we wear according to the procedure performed. There is a detailed lecture for personal protective equipment. Please listen to it. When you are selecting your PPE, you must decide what you wear according to the type of the exposure anticipated. Is there any splashes or not? The durability and the appropriateness of the PPE for the task. Do you need a fluid resistance gown or not? Also, the size. It must fit. We must know the right technique in donning, meaning wearing your PPE and the sequence, and in doffing, meaning how to remove your PPE and the sequence. When donning gloves and before providing any treatment, you must inspect them for manufacturer defect or tears that may not be easily visible but can allow blood or other potentially infectious material to contact skin. And when gloves' integrity is compromised for any reason during the treatment, you must stop, remove them, perform hand hygiene, and wear new gloves. During the pre-treatment stage, the unnecessary items or unused equipment should be removed from the operatory field. Why? Because we don't want them to get contaminated during our work with spatter or aerosols. But if we cannot remove it for any reason, it must be covered to prevent it from getting contaminated. In addition to that, when you remove the unnecessary items, the placement of the barrier will be easier. Also, the cleaning and disinfecting of surfaces will be faster. Another point is to arrange the items in their correct places in an organized and tidy manner so that you can reach these items easier and faster, and you know if you have all the products that you need or you need to order more. Also, when you arrange the sterilized pouches, you protect them from getting any tears. Try to use pre-arranged tray setups or instrument cassette for routine or frequently performed procedures whenever possible. Some of the trays will be dedicated for restoration or for endo or for prosto. So it's important to choose the right tray. Why? That will help us to avoid having to open drawers and cabinets after you have started a procedure, so to prevent other instruments from getting contaminated. Check the integrity of sterilization wraps, cassette, and pouches before unwrapping. Check if the seal is closed or there is any opening or any cuts. Also, confirm that the process indicator, the chemical, whether external or internal, show that the package have been processed in an autoclave or dry heat sterilizer. But remember, do not open the instrument until the patient is on the chair. Why? Because we want the patient to see that this instrument is sterilized so that he won't get scared or think that this instrument have been used before or not cleaned. During the preparation phase, try to prepare single-used items as much as you can. So try to use the single-use materials and devices for the procedure whenever possible. Choosing single-use items will decrease the time needed for cleaning and disinfection. Also, it decreases the chance of contamination. Examples are disposable air water syringe tips, disposable suctions, cups, trays, aprons, and so on. What about carbide and diamond burrs? Do we consider them as a single-use items? Well, because they are difficult to clean, they are actually considered as a single-use disposable items, unless the manufacturer instructions indicate otherwise, and they give instructions on specific validated cleaning and sterilization procedure. In this case, we can reuse them after following the instructions. Burr blocks. We minimize the use of the burr blocks, but If we use it and we want to take one of the burrs from it, we use a forceps. Do not return burrs to the burr block, and either if they're disposable to put them in the sharp container, and if it's reusable according to the manufacturer instructions, put it aside for reprocessing. Continue on the same subject, the single-used items, we're going to talk about the barbed broach, that we use it to extirpate the pulp, and the endodontic file, that we use it to shape the canals. So the barbed broach, because they are very difficult to clean, even if we use the ultrasonic cleaner, we discard it after one time. So it's a single-used item. On the other hand, the endodontic file, although it's difficult to clean, but we have to read the manufacturer instructions. If it say it's a single-use item, then we have to discard it after one time. But if it gives us instructions on how to clean it and sterilize it, then we can use it more than one time. But the number of times the file can be used depend on the material of the file, the size of the file, the type of usage that we use it for, and the difficulty of the case that we use it on. We may use it for 3 or 5 times, and then we have to discard it. Because the air water tip is very narrow, it's hard to clean. That's why it's better to use the single-use item, the one that you use it one time and then discard it. But if you don't have it, then you can use the multi-used one. But you must put in your mind that you should have more than one. For each patient, you use one and then put it for cleaning and sterilization. You cannot use just one for more than one patient, or clean and disinfect it and use it with other patient. No, you must change it and send it to be sterilized. Nowadays, even some of the instrument is a single-use item, which is a good thing. If we can afford it, then it's a better choice for us. Pip holders, as you can see them on the right side, the upper pictures, these pips are hard to clean. And sometimes we even forget to clean it and touch it with our bare hands. With time, it may get rusted, so it's better not to use it. We prefer to use the disposable pips. A very important step in the pre-treatment stage is pre-planning the materials needed during treatment. That may be done by reading the patient treatment plan, so we will know what we will do for him. We're going to do extraction, restoration, endo, and so on. The reason for that, because during the treatment, we don't want to open drawers and touching other materials to prevent them from getting contaminated. During clinical preparation, we cover some of the services with barriers. These services are services that we touch during providing treatment, services that's hard to clean, and services that get contaminated with spatter and droplets. Also, the barrier decreases the time between patient because it's decreased the time that we use for cleaning and disinfection. Some of the services that we cover are the headrest, control buttons, arm of the chair, X-ray sensor, X-ray tubing. Also, we use the plastic tubing for the handpiece, air water syringe, and evacuators. So it's very important to identify equipments and services that will become contaminated during treatment so that we can protect them with barriers. Once the treatment is finished, you clean and disinfect your clinic, unless you are using a barrier. In this case, just remove the old one and put a new one on, unless the surface is contaminated. So, between the barrier and the disinfectant, which one is better? Which one do you choose? You have to make the decision regarding the barrier or the chemical disinfection based on the input from all the members of the dental team and consider the cost, risk, and the benefit of each approach. Each one of them has its own advantage and disadvantage. Once a set of procedures are agreed on, standardize them in all your facility. Here are some of the advantages of barriers. Barriers cover hard to clean surfaces, the rough surfaces, the one that's not smooth, and the odd-shaped surfaces if they, for example, have lots of angles. Also, it will reduce the exposure to harmful chemical disinfectant. As we said, Between patient, if you use barrier, we don't have to clean and disinfect. We only remove the old one and put new one on. So it will decrease the amount of exposure to harmful chemicals. It is used to reduce the waiting time between patient. Why? Because it's quick to apply and can be readily changed. So the time between patient will be less. Also, it provides visible evidence to the patient that the infection prevention measures are being performed. When the patients see it, they will feel safe. The service disinfectant may be less costly than the barriers, but they may stain or corrode some of the material or surfaces. Here are some extra examples of services that can be barrier protected. Digital items like X-ray sensor and keyboard for computers are very sensitive to chemical disinfection. So either protect them with barriers or keep them away from the areas where they may be contaminated with spatter or droplets or touched with contaminated gloves. So as we said, if you're using barriers, you must remove and replace them between patient. Every patient, use with him new barrier. You don't have to clean and disinfect between patient unless if you remove the barrier and the surface underneath it gets contaminated with your gloves, then you have to clean and disinfect it. But even if you're using barrier, you must daily, at the end of the clinical session, do cleaning and disinfection. During oral surgery, we use sterile barriers for the surfaces that will be contacted by hands or instrument. For example, we use the autoclavable removable light handles or sheets. Also, we use the sterilization wraps that we use it to place instrument and supplies on it. Before seating the patient, set up your paper record, radiographs, and images. Because during treatment, we want to avoid any contamination. We don't want to touch it with our contaminated gloves, and we want to protect it from any spatter or droplets. If you want to read your paper records or write on it, you should do that before you put on your gloves or after you remove it and wash your hands. To decrease surfaces touched by hand, consider use of voice-activated devices. Water quality is a very important issue in dental clinic. We have a lecture dedicated to this subject. You must put in your mind the importance of this subject. One of the important points is to follow the manufacturer directions for care and maintenance of the water line. Flushing water lines. All dental water lines and handpieces in each clinic should be flushed in the beginning of the clinical day and at the end of the day for several minutes, also between patients. The CDC recommends running handpieces and air water syringe for a minimum of 20 to 30 seconds after each patient. Why? To discharge any foreign material that might have entered the turbine or air or water line. This will not remove the biofilms from the lines, but it may temporarily reduce the microbial count in the water. Water reservoir for the clinic is separated from the municipal water supply. It shouldn't go directly to the dental clinic. You should use filters. The filters are used to keep the microorganism out of the water, and these filters should be changed according to the manufacturer instructions. Follow the right procedure in testing the water lines in the dental clinic. Each dental clinic should be tested twice a year. So, test the dental unit water and treat it if the bacterial count exceeds the CDC recommendation. Now we're going to talk about the second part, which is infection prevention and control practices during the treatment period. Now, the patient is on the chair. As we said before, if it's possible, do your hand hygiene while he can see you. Then, wear the PPE that you prepared for the procedures you are doing. Just a quick reminder, to have an effective hand hygiene, you must do the right technique, using the right material during the right time period. Also, you must know when to do hand hygiene. This is the right technique to follow, the right time period for hand washing and for hand rubbing. And don't forget, alcohol-based hand rub kill bacteria more effectively than soap and water. When wearing or donning our PPE, we should follow the right sequence. The first step is to do hand hygiene. The first thing to wear is the gown, then the mask or respirator. After that, the goggles or the face shield. The last thing to wear is the gloves. Now we're going to prepare the patient. First thing, if the patient doesn't have an eyeglasses, we provide him with a reusable or a disposable eye protection. Secondly, we use a disposable patient napkin with a disposable holders. Why? To protect the patient's clothing from exposure to droplets, spatter, aerosols, and any chemicals. For the surgical procedures, we consider using the sterile drops. During treatment, you must be very careful when handling sharp instruments that can penetrate gloves and cause injury. So, to protect yourself from sharp injury, you must be aware of the location of these sharp objects. These sharp objects include the rotary instrument, which are the burrs, the diamonds, and files, also the other potentially sharps, like the metal matrix bands and orthodontics. So the solution for that is to remove the burr, the diamond, and the rotary endodontic file from the handpieces when not in use to avoid any injury. The other thing that we can do to protect ourselves from sharp injury is use care when receiving, handling, or passing the sharp instrument. And how is that done? Never hand pass the exposed sharp, like the needles or the scalpels, between the dental healthcare personnel. If the dentist asks for a sharp instrument, the assistant should place the requested instrument on a bracket tray or other barrier-protected surfaces for retrieval by the provider, with the provider repeating the process when finished with the instrument. For an added margin of safety, verbally announce when you place sharp in the predetermined location. So, to protect injury during and after use, if it's available, use needles and blades with a self-shedding mechanism or other engineered safety features. As you can see here on the right, the needle, you can retract it or it's self-covered like the blades here. You must be very cautious when handling dental anesthetic syringe. So, if you're planning to give the patient anesthesia, never use your hand retracting the cheek. You must use mirror or any other instrument. Also, after you finish giving the patient anesthesia, you must recap the needle in between uses and after finishing. After finishing using the sharp instrument, only discard it in the sharp container. Also, you must be very careful not to send it to the SSU. Sharp containers have different sizes, so be sure to choose the right size according to the amount of sharp produced during your treatment. The location of the sharp container is either hanged on the wall or placed on a trolley. The most important thing that it should be at or below the eye level near the point of use. During recapping of needle is where you could get your needle stick injury. So you must take special precaution with syringe and needle. Never recap it with your two hands, and you can use the recapping devices. Also, you could use the one scoop technique, the one hand technique. This technique is done by putting the cover on the table and then sliding the needle inside it without touching it with your two hands. So, in order to prevent the needle stick injury, you should plan how to safely handle and discard the needles before starting your treatment. And don't forget, needle stick injury should be reported. So, what's the fuss? Why are we talking about sharp injury, how to prevent it, and if it's happened that we report it and follow it up? It's because some infections may result. The needle stick injury can expose worker to a number of blood-borne pathogens that can cause serious or fatal infections. If the healthcare worker gets needle stick injury and the patient has hepatitis B virus, there is a chance that he may get it from 6 to 30%, unless if the healthcare worker is vaccinated. Also, if the patient has hepatitis C virus, there is a chance that the healthcare worker may get it by 1.8%. And if the patient has an HIV virus, there is a chance for the healthcare worker to get it by 0.3%. So, the best way to protect yourself from these infections is by preventing needle stick injury from the first place. We'll revise some of the points to protect ourselves from needle stick injury. The most important thing is to avoid recapping needles, either by doing a one-scoop technique or using devices with safety features. The CDC estimated that 62 to 88% of sharp injury can be prevented simply by using safe medical devices. You must dispose the sharps immediately after using them in the disposal container, the sharp disposal container. If you get needle stick injury, you must report it as soon as possible to ensure that you receive the appropriate follow-up care. Also, another important point is to get the hepatitis B vaccination. At the end, you must follow the standard precaution, including the PPE. You must use a rubber dam whenever possible to protect the patient and the dental healthcare personnel and their environment. During treatment, use rubber dam or vacuum-assisted isolation device and high-volume evacuation whenever possible to limit the splashes and spatter of blood and saliva and generation of potentially infectious droplet or aerosols from getting on the dental healthcare personnel and the environment around them. Use the high volume evacuation for all the ultrasonic and air turbine restorative procedure to minimize the generation of potentially infectious droplet and aerosols. After wearing your gloves and starting your treatment, to prevent any contamination, avoid touching the unprotected switches, handles, and other equipment. If the objects are touched, then you must clean and disinfect them at the end of the procedure. And remember, avoid entering drawers or cabinet once your gloves have become contaminated. In order for this to happen, use procedure-specific standardized tray setup. To ensure necessary supplies are available during your treatment, so that you will avoid opening the cabinet and drawer and prevent them from getting contaminated. But when unplanned situations arise and additional supplies or instruments are needed, several options are available. Either wear an overglove over your contaminated glove, or request assistance from another member of the dental team, or remove your contaminated glove, perform hand hygiene, and then re-don a clean glove. After that, you can retrieve the needed item and resume your work. During surgical procedure, you should never use the dental unit water as an irrigation for the surgery. Only use sterile water. This sterile water, you could get it either from a special sterile water delivery system or hand irrigation using sterile water in a syringe. Saliva ejectors. One of the saliva ejectors in the dental unit is the low volume. The most problem with it is the backflow. Studies have reported that backflow in low volume suction lines can occur, and the microorganism in the lines can be retracted into the patient's mouth when a seal around the saliva ejector is created. For example, if the patient closes his lip around the tip of the ejector, It will create a partial vacuum where the pressure in the patient mouth is less than that in the evacuator, which will cause the backflow. Furthermore, studies have demonstrated that gravity pulls fluid back toward the patient mouth whenever a length of the suction tubing holding the tip is positioned above the patient mouth. So it's very important to position the tube in the right place. Also, if you use the high and low saliva ejector together, the valve will be closed, causing the backflow. Nowadays, a majority of recently manufactured dental units are engineered to prevent retraction of the oral fluid. Also, units made after 2000 have valves, but sometimes these valves close because either there is no maintenance or the patient closes on it so hard. Now for the third part, infection prevention and control practices during the post-treatment period of the patient care. So after treating the patient, remove your gloves but keep your PPE on until all contaminated sharps and other disposable items have been discarded. Keep your PPE on until all the instruments have been prepared for safe transport to the instrument reprocessing area. Keep your PPE on until all operatory cleaning and disinfection procedures have been completed. Continue to wear your PPE during your cleanup. So as we said in the previous slide, to remove your gloves. But what should you wear? So before cleaning and disinfecting the contaminated surfaces, you must remove and discard the gloves that you used for the patient care. After that, perform hand hygiene with either the alcohol-based hand rub or the water and soap if the hands are visibly soiled. Then you should wear the heavy utility gloves and continue to wear the other protective equipment, which are the gown, mask, and eye protection. You should wear it while cleaning and disinfecting the contaminated surfaces. To start your cleaning process, you must remove all the disposable barriers. Now, you must determine which surfaces and equipment to clean. You should clean and disinfect all items and surfaces not protected by the barriers. Also, even if these surfaces were protected by the barrier but got contaminated when we remove it, we should clean it and disinfect it. What type of disinfectant should we use? Well, we should use an EPA-registered intermediate level surface disinfectant. It must be compatible with the surfaces undergoing the disinfection. This disinfectant must be high enough to kill microorganisms and low enough not to damage the surfaces. And remember, in order for the disinfectant to be effective, you should follow the manufacturer instructions for the proper use of the MOH registered hospital disinfectant for the right dilution and the right contact time. Use non-woven towel when cleaning the chair. These towels are single use and they won't leave any mark after using them. In dental clinic, we must know the clinical contact services and the housekeeping services because each service there is a person responsible for it, and the type of disinfectant is different according to the type of service. Some examples of the clinical contact service are light handle, countertop, bracket tray, dental chairs, and the door handle. The housekeeping services examples are walls, sinks, and floors. For handpieces, you must follow the manufacturer instructions for the cleaning, lubrication, packaging, and sterilization. It should be followed closely to ensure both the effectiveness of the process and the longevity of the handpiece. The handpiece, as we know, is very expensive and is very essential in our work. The internal surfaces of handpieces can be contaminated by bacteria in the dental unit water lines and by Try aspiration of material from the patient's mouth if the anti-retraction system is not working. Also, small amounts of saliva or blood can be retracted into dental handpieces water channels, as well as air water syringe and ultrasonic scaler during treatment. So, you should run the instruments between patients to flush out contaminants before removing these instruments for cleaning and sterilization. Another point, you should allow water lines to run and discharge water at the beginning of each clinical day without the handpiece for several minutes to reduce the overnight microbial accumulation. And don't forget to do flushing for 20 to 30 seconds between patients and at the end of the day for several minutes. You should flush the handpieces, the ultrasonic scaler, and the air water syringe. Also, any other devices that are connected to the dental unit air or water system. So, after treating each patient, you should remove the detachable handpieces, sterilizable air water syringe, and other devices for transport to the reprocessing area for cleaning and sterilization. So, as I said, these handpieces should be cleaned and sterilized. So, surface disinfectant or immersion in high level disinfectant is not enough. And never attempt to clean them in an ultrasonic cleaner or use highly acidic water or use organic solvent such as benzene or thinner. Avoid using abrasive cleaning agent and wire brushes because these will cause scratches on the surfaces of the handpiece and damage them. Before removing the handpiece after treating the patient, you should remove the burrs. Some of the brands of the handpiece require a blank burr when lubricating it. So, you should place a blank burr in the handpiece during cleaning to prevent the contamination of and damage to the handpieces bearing during lubrication. When you want to clean the outside of the handpiece, just wipe it down. Do not submerge the handpiece in water or any other solution when rinsing away the detergents. After washing with a thermal disinfector and prior to lubrication, it's important to thoroughly dry the handpiece until all the internal moisture is removed. Why? The moisture remaining inside the handpiece can reduce the effect of lubrication and lead to corrosion. So, dry the handpieces manually and allow them to stand vertically to allow all the water to flow out under the gravity from the inner tubing before processing to lubricate them. After cleaning the handpiece, you should lubricate it before sterilization. Lubricate the handpiece for the recommended period. Do not excessively lubricate the handpiece because it may compromise the sterilization process. Check for debris in the expelled lubricant. If the lubricating oil is not running cleanly, then repeat the application. After lubricating the handpiece, it should be run in purge or flush mode using compressed air to expel excess material. Clean off any excess oil from the exterior of the handpiece and place it to drain vertically for several minutes over a disposable paper towel. Put in your mind that at the start of each clinical procedure, run the air turbine handpiece briefly over a piece of gauze to clear excess lubricants before using it in the mouth. Using a paper plastic pouch, it's important to place just one handpiece in each pouch. When storing the sterilized handpiece, it should be stored in a head-up position, where the head of the handpiece is higher than the body. It should be stored in a normal room temperature and humidity in a well-ventilated area out of the direct sunlight and away from the dust. How to clean the high volume ejector and saliva ejector lines. You could do that by running a clear water and use it with it to remove the gross debris from the lines. And don't forget to discard the tip if they are single use. Also, you can clean the high volume ejector and the saliva ejector lines with vacuum line cleaner on a scheduled basis. But don't forget, when you want to clean the vacuum lines and the chair side traps, you shouldn't use the bleach or the chlorine containing cleaners, because if there is amalgam, it may lead to dissolution of solid mercury. After finishing treatment, we must classify our instrument. Are they reusable or single use? If they are single use, then we must discard it appropriately, meaning that we must follow the medical waste classification. Are they regular waste or medical waste? And if they are medical waste, are they sharp waste or not? We're going to talk now about the medical waste. As a rule, you should dispose of any medical waste according to the MOH regulation. So, if we have sharp waste, we must carefully place all sharps, including needle, scalpel, blades, burrs, endodontic files, and other patient care items capable of breaking the intact skin into lockable, meaning we can close it, punctural resistance, meaning that nothing can go through, biohazard container with the biohazard label for disposal as regulated medical waste. As a general rule, do not overfill the sharp container and the medical waste bag over 3/4, because we want to protect the healthcare worker from getting injured or getting contaminated. Also, don't forget to use the locking feature prior to disposal, meaning that you have to close the sharp container and you have to tie the medical waste bag so it won't fall on the floor and contaminate the environmental service. According to MOH, the waste is classified as either regular waste or medical waste, and we should know what items goes where. You can refer to the medical waste lecture. Now to the other part of the dental instrument, which are the reusable ones. First, we must prepare this instrument for transportation. That is done by placing the instrument in a rigid leak-proof covered container. This container is color-coded with biohazard label. When we place the instrument inside, we must lock it. After that, we transport it to the instrument reprocessing area. The container have different sizes. We choose the size that is enough for the instrument that we are transporting it. When you want to place the instrument into the container for transportation, wear utility gloves. You must pick the sharp instrument individually and never grab instrument by the handful. And be especially cautious when handling the double-ended sharp instrument. You must handle it in a way not to injure yourself. During the transportation process, we want to protect the carrier, the environment, and the patient from getting contaminated from the contaminated instrument. So, when transporting the instrument to the reprocessing area, we must avoid walking through the patient waiting area or other non-clinical spaces. Also, do not put the instrument into the containers filled with the holding solution prior to the transportation. Why? To avoid the risk of spillage. Instrument cleaning. Instrument cleaning should not be performed in the dental clinic or any other treatment location. Why? to limit the contamination of the environment or contact surfaces. But we must remove the gross debris, like the restoration, because we don't want it to dry and make it hard to clean. So all the instrument should be cleaned in a designated instrument reprocessing area. It's where you disinfect it and sterilize it also. You cannot sterilize the instrument inside the dental clinic. When we take the instrument to the reprocessing area and there is delay in the cleaning for any reason, we must place the instrument in a holding solution. This holding solution will keep the soil from drying on the instrument. Examples of the holding solutions are dilute detergent solution or commercial enzyme-based holding solution. We cannot use the household bleach or other disinfectant that don't have label claims for using as a holding solution, and we should never use it for that purpose. If you have a sink filled with soapy water and instrument, you cannot put your hand inside it because you may injure your hand with any sharps there. So never reach into the trays or containers where instruments are not easily visible. When we compare the ultrasonic cleaners and the instrument washers with the manual cleaning, we find both of them safer because we don't handle the instrument, so less contamination and less injury with the instrument. It's also more effective in cleaning and reliable. But if you must use the hand scrubbing, then we must wear a full PPE, heavy utility gloves, protective gown, surgical mask, and eye protection. If we're going to use the hand scrubbing technique, we use detergent and water and using the long handle brush. Why long handle? To protect ourselves from the splashes or spatter or droplets. After cleaning the instrument, rinse it with water, then inspect it. Is it clean or not? Then we leave it to dry. When it's dry, then we wrap it for sterilization. When we compare the instrument washer or washer disinfector with ultrasonic or the manual cleaning, we find it's more simply in cleaning, rinsing, and drying process. And also, it reduces the risk for percutaneous injury during the instrument handling. Also, they eliminate the need to manually discard and replace the used ultrasonic cleaning solution. Burrs. Before sterilizing the burrs, you must clean it very well, from tooth tissue debris, dental materials, and blood clot. You must clean it using the ultrasonic cleaner because burrs are hard to clean. And make sure not to use the steel brush because steel brush may cause scratching on the burrs and that will affect its functionality and may lead to corrosion. Put on your mind this fact that no technique can fully remove the organic debris and therefore result in successful sterilization of the burrs. For the reason that they are hard to clean, burrs and files are intended for single patient use and discarded afterwards. There is an exception for that. Clean and sterilize diamond and endodontic files if the manufacturer has provided description a validated cleaning process. So if they say you can clean it and they give us the steps, then clean it, sterilize it, and reuse it. But if there are no validated instruction for cleaning, then we consider these instruments which are difficult to clean as single-use and disposable items. Now, if these burrs and files are reusable, so in the cleaning process, we must use a wire brush. The problem with the wire brush that it places the hand in close proximity to the contaminated sharps. So, in order to make this instrument away from us and protect us from getting any injury, use extreme care and use needle holders or hemostat that will securely hold this instrument during cleaning. When you want to lubricate the handpiece or try it or flush it, you must use a small smooth burr and plug it in. Never try it without burr inside because the headgear is made of either stainless steel or ceramic, and if you use it without a burr inside, it will be damaged. After cleaning the instrument, inspect them for their cleanliness and their functionality. Then rub them and sterilize them or disinfect them as necessary. When the sterilization cycle is finished, leave the instrument to cool down, but inspect them. If they are wet, then there must be a problem. Also, make sure to not try it on the back because that may cause perforation of the paper. There are several indicators that we must monitor for the sterilization process. The physical indicator that monitor time, temperature, and pressure. The chemical indicators, which are external and internal, and they monitor whether the parameters to achieve the sterilization have been met for a specific sterilization process. Bowie-Dick and biological indicator. Bowie-Dick is used to evaluate the performance of the pre-vacuum sterilizer by confirming the adequate air removal from the sterilizer chamber. The biological indicator is a test system containing viable microorganisms providing a defined resistance to a specific sterilization process. The Bowie-Dick look like this when unused, and to be considered as pass, it should look like this. Bowie-Dick will fail if the typical wet steam failed, and it will look like this. Also, if the typical air leak failed, and it will look like this. And if the typical superheat failed, it will look like this. After cleaning and disinfecting the environmental surface of the dental clinic and removing the instrument, whether to place them for sterilization or dispose them as a single use, you should remove your PPE. It should be removed inside the clinic. Do not leave the clinic with your PPE on. When you want to remove your PPE, you should follow the right sequence for doffing. First, remove the gloves, which is the most contaminated. Then, the goggles. After that, the gown. The last thing to remove is the mask, because we don't want anything to enter our respiratory tract while we remove the other part of the PPE. Lastly, we must do hand hygiene. While you're doffing your PPE, if your hand gets contaminated in any step, then stop, wash them. After that, complete removing your PPE. Air compressor. So, what makes a dental compressor so special? The air that is produced by the compressor is used directly into the patient's mouth. The patient will inhale the air and swallow any contamination that is within the compressed air. We have another question. Is installation location important? Well, yes. The quality of the air produced is as good as the quality of the air that is sucked in. So, in a hot, damp-boiled room or in a cold and damp basement, the chances of dirt, water, and bacterial growth in the compressed air system is much higher. Usually, at the end of the day, the dental chair is elevated, as you can see in this picture. But do you know why? Usually, the dental chair is elevated because we want to give the housekeeper a chance to clean under it. Also, it protects the tubes and it gives a chance for the fluid to go down. The golden rule in the dental clinic that everything should be cleanable, and the instrument that you're not using or the equipment should be removed from the field to protect it from getting contaminated. Thank you for listening, and please don't hesitate to contact us for any question.